Hey, welcome once again to our live stream. What are we doing today? I don't even know. I couldn't get folks on the radio this morning, whatever, but we're good to go. And it was just great to just hear that live. We were just rocking here. I hope you enjoyed that worship song. And maybe you don't have a relationship with God. Maybe you view these things and you say, what's with you people, man? What's with all you religious people? And we're not just religious people. That's a relationship. And in case maybe you need a little encouragement in that area, let me just read something to you out of the book of Isaiah, chapter 45, an Old Testament prophet, one of the major prophets. And it says, I am the Lord, there is no other. Apart from me, there is no God. I will strengthen you, though you have not acknowledged me. For many of you that have not acknowledged him, God loves you, man. I don't know what else to say, but God loves you. He says, though you have not acknowledged me, so that from the rising of the sun to the place of its setting, people may know that there is none besides me. You see, there's going to come a time, whether you do it in this life, or whether people acknowledge it in their lifetime, whether it was in the 1200s, the 1800s, the 1900s, it doesn't matter. But there will come a time where you see all will know that he is Jehovah, that he is creator, and there's a Savior. And for many that have a real problem with that, you guys are Jesus freaks. No, we're not Jesus freaks. Jesus came to save you and I. It says, people may know that there is none besides me. I am the Lord, and there is no other. I form the light and create darkness. I bring prosperity. I create disaster. I, the Lord, do all these things. I want to encourage you a little bit later also for many that struggle with a lot of different areas in their lives that I feel is with fear, with anxieties, with hopelessness, with a sense of despair. That's a big, big issue in the lives of people today. They have no hope. Many have no hope. When you're hoping in yourself, that's a dead-end street. There's hope here, and I'm going to read this later to you out of Isaiah 43, and then I believe we're going to go over to the Psalms, Psalm 16, I believe, and I love that. I want to read that to you later. I'm going to hold on to that. Thanks for tuning in today. What are we going to talk about today? Today is perimenopause. What's perimenopause? It's a transitional phase. That simply means that as a woman's hormones begin to not just drop, but change, so we'll just say peri, all right, perimenopause. That's a transitional phase. So as a woman's estrogen levels begin to do this over time, which is in essence what happens, we have a tendency to believe and think that you're just going along and then they drop. They don't really do that. So when a woman begins to go through perimenopause, so before I get, I'm not going to list all this stuff on the board and write a million things. So there's going to be some symptoms that I might miss, and they may not be you. This is pretty much off the top of the noggin on the fly, so just bear with me. Perimenopause. I transition. My estrogen levels, you make three, by the way, E1, E2, E3, estriol, estradiol, estrone, two very powerful, estriol, the very weak one. So we typically measure, you see OBs and so on, they measure E2, estrogen. What starts to happen is as this begins to change, drop, go up, drop, what happens is women begin to experience some very significant irregularities in their menses. So we begin to see major irregularities. What you will see is cycles that begin to change and become disrupted. We'll see tendencies for bizarre or disruptions in menses. So you might have periods that extend, they're heavy, flow is heavy. You might have periods that are coming multiple times in a month. There's a lot of dysfunction. Let's just keep rolling. There are issues with anxiety. There's more tendencies towards depression. You may begin to re-experience a lot of those PMS symptoms that you had earlier on in life as you were having premenstrual syndrome. There's a lot of changes that begin to take place. And as I drop some of my papers, we want to talk. Don't drop the ball. I'm going to try not to drop the ball, Josiah, but we're just going to keep this loose and we're going to have some fun. But along with these major things you start to see, but then there's some other things that can start to happen. There can be some vaginal drying. I become, as I mentioned here, anxiety, depression. I become more emotional. I'm just not myself. Skin can begin to dry. Headaches are more of a problem. Crying changes, really deep changes in your emotional issues. I would say even libido begins to change. This is a huge period for change. So the big, peri really is an implication for transition in your menses and in your cycles. This transitioning is happening because your estrogens are 1 month good, 1 month drop, maybe 2 months good, and then a month it drops. A lot of dysfunction. So what is really happening then? Why is there so much dysfunction in how you feel, your sense of well-being? You say, well, it's pretty obvious, Joe. My period, instead of being 3 or 4 days, is 7 or 8 days. I'm bleeding. I go to the gynae. They say they want to do an ablation. They want to put me on synthetic progesterone, a progestin, to try to regulate. But let's just talk about what's actually happening. So when this is actually ensuing, my pituitary gland, who's kind of a controlling mechanism for a man's testes, for a woman's ovaries, for your thyroid, for endocrine system, the pituitary begins to send out some excessive signaling. So a lot of times, I believe it's the FSH rises and LH rises, and I may have this a little wrong so if you're an OB-GYN, and let's not argue the details here. I want to just get into some of the mechanics of what's going on. So what also then happens is your ovaries become overstimulated because there's imbalance. So the body, it's just a bodily mechanism. Your body's trying to bring you back into balance. The problem is the more the stimulation to the ovaries, it creates imbalance. How? Testosterone begins to rise. Progesterone begins to drop. Estrogen, E2, can rise. Now I have a tremendous imbalance. When I have this imbalance, I begin to experience a lot of dysfunction in how I feel. My mood, my sense of well-being, I get more headaches. What is this attributed to? It's really attributed to estrogen dominance and progesterone deficiency. So quickly at a glance, say, well, if that's the case, just give me some progesterone. Natural progesterone, not synthetic, please. That's in part the answer for many of you, in part. But we still have to nourish, we have to tonify the body. We have to provide nutrients that help to bring some tone. We've got to get adequate levels of the Bs because that's how you process and handle your hormones. It's how you make and eliminate your hormones. We've got to have adequate levels of minerals like zinc and copper on board to make sure that you make these. So we're towards the end of this peri phase, we will talk about how we nourish and how we tonify the body. So estrogen dominance, progesterone deficiency. So what does that mean? Does that mean I'm making way too much estrogen? You could be making more estrogen. Or it could be really, this is the key, that progesterone is dropping. Hence, the relationship between the two becomes an estrogen dominant situation. And now what starts to happen to me? I can have things like breast tenderness, headaches become a huge problem, a lot of muscular aches and discomfort. I get a lot of low cramping and a lot of dysfunction with my cycles. I can get heavy menses, headaches, migraines, muscle ache, lower cramping with menses. A lot of dysfunction because principally of this scenario, an estrogen dominance. So, well, why did God make this happen? Why does this happen to us? I think there's a lot of interferences. I think there's a lot of deficiencies that can occur that feed this process. To touch on a few, we've done live streams on thyroid. So if I have confounding factors here, if I have some thyroid dysfunction, that is going to play into this. This is going to add to my female hormone imbalances, my perimenopausal change that should be a transition, right? It's not an evil thing. It's supposed to be a transitional phase, and you could be starting perimenopausal thing. It's supposed to, and you could be starting perimenopausal, and you could be starting perimenopausal pills because it'll regulate my cycles. Synthetic estrogen, synthetic progestins. Let's not go there. Let's nourish. Let's tonify. Let's balance. That's going to be 3 key words you're going to hear: nourish, tonify, balance. Nourish, tonify, balance. We want to balance some hormones. We want to tonify. We want to bring some tone back of all these interacting sites. Your thyroid, your adrenals play huge here. Okay? If your thyroid's off, that can add insult to injury. If you're severely distressed and you're under a lot of stress and you work 2 jobs, or you go to school and you work, or you have children and you're working full time, you're keeping a home, huge problem here. And then we got to nourish. We got to get some nutrients. I've mentioned some of them. And those nutrients become very, very key in helping you remember to make your hormones, to make them in a balanced form and fashion, and then to eliminate and process. So your thyroid, your adrenal, there's another area here that I'm drawing a blank on as part of this. And I don't know why I am. Your thyroid, your adrenals, your liver. How could I forget the liver? See, I do need some notes, Josiah. Liver. If your liver, and let's even go a step farther. If your GI function or your gut flora is imbalanced, I got a huge problem. All right, once again, Joe, this is too complicated. No, it's not. No, it's not. We taught you about thyroid. Check. You should have a free T3, a free T4, a TSH, thyroid antibodies. Because if your thyroid levels are horribly off, this adds insult to injury. I'm under a lot of stress. Well, we've got adrenal essentials. Help you battle your stress components. Check. We'll talk a little bit about the B's and so on and how that plays. Now, this gets a little more tricky. Well, I don't have liver dysfunction. I don't have hepatitis C. I don't have fatty liver. What are you talking about? Well, your liver processes chemicals, environmental chemicals, pesticide, herbicides that we are exposed to, chemicals in the environment. This goofy stuff right here that I'm inhaling right now, really, this stuff you want to whiff?
No.
This stuff smells. There's chemicals in here. Oh, you shouldn't have. Well, I got to teach you. I've got to write this on the board. Who's processing this? My liver. So when I go through a perimenopausal phase and I'm having a lot of dysfunction, I am overloading the liver. And plus, if I don't have a quality diet and I don't have enough fiber in my diet, I don't have enough of the B's and magnesium and nutrients that help my liver do the work of detoxification, now my liver enters into this equation. Why? Because if your liver's overloaded, if it's on overload, you do not detoxify some of your, you don't detoxify your estrogens well. Now, how does this happen? I don't want to get too fancy here, but there's we call a glucuronidation process. There is a sulfation process. We need glutathione. Okay, can I take glucuronidation? No. You don't take those components. These are metabolic processes. This is chemistry in the liver, how you're breaking down, processing your excess estrogens, the mimics from the foods that you eat, estrogen hormone mimics, chemicals. Why is this important? Because if I don't, I begin to recycle these estrogen metabolites, if I don't process them well through the liver, and they go back and they insult this transitional phase. Makes me more estrogen dominant, makes me more prone to the symptoms of breast tenderness, fibrocystic breast disease, anxiety, agitation. My cycles are off. I'm bleeding for 7 or 8 days. What am I going to do? They want to do a partial hysterectomy. And for some of you, it might not be that dramatic. Yours might just be, I just feel bad. Your liver plays a role. So towards the end, we'll talk about how we tonify the liver, how we support the liver. We'll use the word balance, how we balance some of your hormones. We got to tonify the liver a little bit. And then how we nourish. How do we nourish? Say, nourish my hormones? What in the world? No, how do we nourish the body so that I can literally effectively do this process? So we talked about check for your thyroid. We taught you about that. We've done some adrenal live streams. You need to go back and watch it. Just watch the stress and anxiety part. And I don't know that we've done one specifically on adrenal function. I don't believe. That's probably a new, that's our next live stream, okay? So the adrenals, but for right now, we do adrenal essentials, help you get through your stressful components. And then I got to have quality liver functioning. My liver could be overloaded because I eat too many processed foods, too much white food. I don't have enough live foods. I don't have enough fiber. I don't have enough good bacteria. That's more with the flora. Liver becomes overloaded. It doesn't detoxify well. I recycle components. It aggravates an already dysfunctional or difficult transitional period. The gut flora becomes the next part of this. Now, why is the gut flora important? I've already given you some of those answers. If I don't have adequate levels of bacteria, good, that is in good bacteria. If I don't, and bad bacteria predominates, something called beta-glucuronidase thrives. That rises in response to antibiotics and so on. So if beta-glucuronidase in your gut is rising because of imbalanced microflora, what simply will happen is you will recycle estrogen metabolites, not necessarily the metabolites. They're not completely broken down. It's called a deconjugation process. Don't want to get into that too detailed, but you need to know that it's real. I don't make this stuff up. Estrogen metabolites, once again, come back here, pow. So if I've got poor thyroid function, I feed the bad cycle. If I'm under a lot of distress and my adrenals are weak, not balanced, not nourished, I feed a perimenopausal phase. If my liver's overloaded because of a poor diet, not enough live foods, real foods, I begin to get a clogged up liver. I don't break down my estrogen metabolites well. Boom. I aggravate this process. Oh, by the way, I got a history of antibiotics. I use minocycline for skin problems. I had a MRSA infection. I was on antibiotics for 3 months. I was on antibiotics because had Lyme's, or I've had chronic sinus infections over the history of my life. And what else was I going to do, Joe? Or maybe you just eat very poorly. There's a lot of you that are addicted to sugar. We have a live stream for that, by the way, too. But we're addicted to sugar. We eat too much sugar. We're growing bad things. We're growing bad bacteria. We don't eat enough fiber, soluble fiber foods. What happens? Beta-glucuronidase rises. It deconjugates in other words, instead of it linking up the estrogen metabolites and you eliminating them in stool and in urine, but technically in the stool as well, estrogen metabolites get recycled. I feed on that. So now I've got a big loop. So if I'm not tonifying, I hope you got this. It's complicated. I don't want to make it complicated. But if I am not nourishing, I am not tonifying, I am not balancing, I feed this transitional process and I make it worse. I don't enhance it, I diminish it. My perimenopausal transitional phases get worse. If I can nourish, if I can tonify, if I can balance, if I can facilitate, would probably be another word that I would use here, I can diminish some of the complications that are going to ensue. Okay, perimenopause. So what do we want to do? So we've gotten some of the characteristics. Let me make sure I didn't miss anything. Decreased libido is a problem. We talked about low progesterone, rising levels of estrogen. This is the part I did miss. Let me talk about this. Fibroids, uterine fibroids, are at a much higher rate a lot of times for cycling 30-somethings and even 40-somethings that are going through. Why? Because it's poor liver function, it's poor gut flora, it's estrogen dominance, progesterone deficiencies. I'm more prone to uterine fibroids. And I think there's some other things, environmental chemicals, et cetera, that affect us. Endometriosis can flare at this point. A lot of times it's earlier in life for a lot of women, but you can have a flare here as well because of the imbalance of hormones. Uterine fibroids, endometriosis, fibrocystic breast complications. I'm missing something here. Endometrial hyperplasia. How could I forget that? What does that mean? What does that mean? What's that mean, Josiah?
I don't know.
What's that mean?
How could you possibly remember that?
How could you possibly remember? Endometrial hyperplasia. How could I forget it? How could I remember it? What does that mean? That means the lining of your endometrium, instead of it staying thin, balanced because of progesterone, estrogen balance, the endometrium begins to thicken. And your OB-GYN can measure that. When this happens, you're going to have more irregular menses, more irregular cycles, heavier bleeding because you're trying to shed this excessive lining. We need to keep it thin. We need to keep it more natural. Endometrial hyperplasia, all that means is thickening of the endometrium. Endometriosis, I don't want to get into that. That's a pretty complicated subject. Uterine fibroids. So all of these are complications of dysfunction in this perimenopausal phase. All right? So, where are we here? I think what I'd like to do maybe at this point, let's finish this, then I'm going to come back and then we're going to do menopause. So we're going to break now? Or we want to? Okay. Let's we got a break. I know that.
We're flying, baby.
Woo! I know. Oh my goodness.
Cooking.
What am I doing here? All right. Tonify, nourish. Okay, so what will we want to try to do with perimenopause? What are the first things? You do a consult with me, you're in the office, you're over the phone. What are the first things? I'm going to really look at your diet. I want to know how much fiber you're eating. I want to know the quality of your diet. I got to know how much real food you're eating, how many processed food. This plays a huge role. So your diet's going to be, so this is part of the nourishing part, if you will. The next part would be, I might want to do just some good bacteria, some probiotic essentials. Oh, well, that's great insight. Oh, it's really good insight. You know why? Because this probiotic essentials can help to lower beta-glucuronidase. Remember that real fancy term? When I lower that, now I easily eliminate my estrogen metabolites. I might want to do a little bit of liver support. There's multiple ways here. I think I'm going to go, I used to just use detox essentials, but we're just going to go and use something called CDG, Estro Dim. All that really means, it's got diethylmindane, indole 3 carbonyls. These are concentrates of the Brassica family, broccoli concentrates. Drawing a blank. The Brassica family, cauliflower, broccoli, and so on. Don't mess with leucobrazzi, not the Brassica family. So liver function, I've got to improve liver function. I got to get more good bacteria. So this is part of the nourishing part, okay? All right, this is going to start to be even nourishing here as well. I do basic support. What I might also have to do is do a female hormone panel. We'll use ZRT as a saliva test to measure your estrogen levels, your testosterone levels, and simply just do 3, your progesterone levels. If there's imbalance, and usually what happens, testosterone is high. Usually, got this on my shirt last week, so let's not do that again. Progesterone is low, and usually estrogen can be either fairly normal or it can be high. Now we've got to balance these guys. Nourish with the foods, a quality diet never changes. I don't care what your problem is. Do you have to go gluten-free here and dairy-free? Maybe dairy, but you have to go on elimination. I don't know. I just got to get you eating a wholesome, really, not just whole grains. Your wholesome thought has to change. A lot of vegetables, beans, legumes, fibrous fruits, vegetables. Take probiotics. Do a little bit of liver support. Because now I'm nourishing the gut. I'm literally bringing some balance to my body. You say, this helps? You bet your bottom dollar. What about the role of the bees? So we need to get you on something like the Daily Essentials as well. So here's the Daily Essentials, CD Estro Dim, Daily Essentials, CD Estro Dim. Why do we got to do these things? Probiotic Essentials, because now what I'm going to do, I need to make sure I have adequate zinc, copper. Oh, the bees, the family of bees, B6, B1, B2, B12. Huge, huge factor in balancing perimenopausal phases because it helps your adrenals as well as processing of your hormones through your liver. So now vitamin A, believe it or not. So why would I take these all individually? No. Take a quality, not a one a day, not you know, Centrum, or I shouldn't say specific names, pardon me. Quality formulations that you absorb, that you're going to get nutrients from. This is part of the tonifying portion because I'm bringing tone back to the body because I'm going to give you nutrients that help me make, listen to this please, to make my hormones in a more balanced fashion. That's a whole nother subject. I could talk about that. I could draw you a little diagram here that will show you that, but you just got to take my word for it. I've got to get you on a Daily Essentials so that I can drive in adequate levels of copper, zinc, the Bs, vitamin A, and more, but those are the key players. So this is, in part, now how we begin to deal with the perimenopausal phases. You might need some natural progesterone to balance. Your testosterone might be high. So if I do some natural progesterone and make that recommendation, that helps to balance your estrogen, right? What if your testosterone is high? I might have to put you on a little more of an aggressive protocol. I got to get you exercising. I've got to get you moving. I got to get you really reducing the number of carbs, white flours, sugars, etc. We can do some other nutrients. I don't even want to put the name out there right now because it's too complicated. But what am I after here? I got to lower testosterone. Do you know why? Because if testosterone keeps rising, it'll cause you to gain some weight. As I gain some weight, my fat cells will aromatize more estrogen to testosterone. Testosterone keeps rising, and then testosterone starts aggravating this process again. Testosterone, estrogen imbalance. So you say, that's way too complicated. No, it's not. What I've got to do is I got to get you to change your diet. Well, how am I know if these levels are off? That's why you do a saliva test. Or you can do urine and so on. Still too expensive, in my opinion. Saliva gives us a pretty good, a valuable marker for minimal expense. But urine might be the best way. I'm being honest. Blood, I believe, is the worst way to find out what your hormones are. Saliva hormones might be the second best, but I'm married to it simply because it's very cost efficient. It's not cost prohibitive. The urine testing a couple years ago was still $600-700 a test. Very expensive. Not many folks can do it just to find out what my levels are. $90 to do testosterone, estrogen, progesterone. Urine testing now down to $200 to $300. A little better. Eventually we might talk more about that. For right now, I'm still going to advocate saliva because of the cost and the efficiency that it brings. So now I do some things to balance, right? So that was where the balance, we talked about tonifying, nourishing. So I might need some progesterone to balance off estrogen. If I got too much testosterone, I got to really look at my diet. If you're insulin resistant, I got to make sure I get you on D3. I might do a little bit of ultrachrome. Lots of fiber. I got to get you on flax seeds, real ground up crushed flax seeds. How about some steel-cut oats? All this is balancing. Then what about literally balance? Balance. This prep is very interesting. Licorice root, peonii, which is a form of peony, an herb, and chasteberry extract, Vitex. Especially the Vitex, but I will tell you, licorice and peony as secondary components. This is an amazing prep. Love this prep at helping to balance women through perimenopausal perimenopausal phases. You might still need some progesterone. You may still need to balance and reduce some of your carbohydrate intake. That could be critical. You might still need to be on some probiotics, probiotic essentials. Okay, so we're getting a little bit of the picture here. So perimenopause, I've got to have you on daily essentials. You need the Bs, you need zinc and copper and vitamin A for how you make and process your hormones. I've got to reduce beta-glucuronidase, bad bacterial components in the gut so I don't recycle my estrogens. I might need to be on additional natural progesterone to balance my estrogen. See, but this is not some one, oh, just give me a supplement. Well, why can't I just take this balance? Oh, this will probably help you. This will definitely help you. But I still have got to get some of these other nutrients. I still have to get you to look at your diet. If you're overweight, I really need to deal with your weight issues because that's feeding the process, right? So what are the key words we're after here with? Well, my doc said, forget this Joe DiMatteo guy because he's a loon bird and he's not a medical doctor and he doesn't know what he's talking about. So I'm going to put you on oral contraceptives. You're 43 and you're going to go on the birth control pills. No, I wouldn't put you on birth control pills. I'll put you on progesterone. That'll shut down. It'll thin the endometrial lining. It will. Will it work to help? It will. It'll probably settle your cycles down, all of that. This is a synthetic progesterone, prone to headaches, women that use it, bloating, huge issues with just a poor sense of well-being, edema, fluid retention, nausea. By the way, it stimulates your breast tissue, this synthetic, counter to what natural progesterone does. I don't think you want to go medroxyprogesterone route. I don't think you want to go a birth control pill route. Your doc may say, but you don't understand. I'm a medical doctor. Your endometrium is way too thickened. I've got to do an ablation or whatever. Okay, I get that. But this is really, I don't want to deal with the details of that. I really want to deal with how we tonify, nourish, balance many of you that are in this phase that are just battling some difficulties. We're going to slip to a break. I'm going to play a little worship song for you. And then we're going to come back and we're going to give you some, try to give you some stuff on menopause. We'll see. We'll see. I'll figure that out in the next 3 to 4 minutes. Stay tuned. Watch this video for us. We're back. Thanks for staying with us. We're going to move on to menopause. We've discussed in the first section, an extended first half of the section. So I might have to condense down the menopause portion. But I still think I can make my point because many of the perimenopausal issues are applicable to the menopausal issues. So let's just jump right into it. Menopause. Now I've transitioned away from the peri stage. Remember, peri is transitional. So now I'm in the menopause stage. Let's just say this. It's characterized by dropping levels, reduced levels of estrogen, reduced levels of progesterone, sometimes elevating or normal testosterone levels, or actually balanced levels. This all creates, am I over here? This creates a complete level of dysfunction because many women then actually will grow more facial hair. It is very easy to gain weight in this scenario. I just don't feel well. I am more prone to bone loss and osteoporotic issues. Women that once they have almost a complete cessation of their hormones, their osteoporotic risk for the next 5 to 8 years is dramatically up. Your cardiovascular disease risk for the next 5 to, I believe, 8 years rises dramatically. Why? Because there's a loss of functional hormones. Then why did God allow this to happen? Now, I didn't deal with this on the perimenopausal side, but I think that in many cases, the reason why we see so many hard women just kind of falling and skinning their knees and having so much difficulty with perimenopause and menopausal phases is because we have a tremendous imbalance in our hormones triggered by environmental estrogen mimics, environmental estrogen compounds the components that used to be in these types of plastics. This is BPA free, but bisphenol A, pesticides, herbicides, they're mimics to estrogens, mimic to hormones. I believe it's associated with, first of all, male problems, with male infertility, dropping rates of sperm production and quality of sperm because of a change in males with their hormones, but in females as well. So I believe why I personally, and I feel there's enough literature to back this up, that why perimenopausal phases and menopause are so dramatically problematic for women, because there are so many external influences that we did not deal with 50 years ago, 100 years ago, let alone 1,000 years ago. Does that mean it was easy for women? No, I'm not saying that. I'm not claiming that. But we consume too much alcohol. Our diets are radically different, than even 50 years ago, let alone hundreds of years ago, because of processing of foods. You have diminished nutrient. You're not tonifying and nourishing the body so that you can process and make hormones more efficiently and eliminate them. I firmly believe this. We are seeing greater difficulties with perimenopause, even premenstrual syndromes, let alone menopause. I think women fall harder, hit the ground harder with these changes because of the dramatic imbalances that are not just normal. You say, wait a minute, you said this was normal to life. Yes, it's normal to life. These balances are created in abrupt or dramatic fashions because of our physical inactivity, high levels of stress. Remember the adrenals. See, if I'm under a lot of stress, I'm driving kids to soccer and to this and that, or my children are involved in events, and I work all day, and I fly home, and I don't eat, and I go through the drive-thru, and I try to get to their sporting event or to their dance class, and I'm trying to do all this stuff. And all this stuff, I'm not saying that it's bad. We just have to find a little bit of a balance, because it is aiding and abetting a hard fall for women perimenopausally and menopausally. So I want to make sure I'm clear on that. I'm not saying that this is necessarily something that women didn't experience. They most certainly did years ago. And for some women, it was dramatic and it was harsh, obviously. It is harsher, I believe, in today's world because of lifestyle, stress, lack of a quality diet, lack of tonifying and nourishing the body. We just don't rest as well. There are a lot of factors that play into this. Okay, bone loss, cardiovascular disease risk goes up. Memory, cognition becomes an issue. There are increasing rates of irritability, anxiety, emotional imbalances, vaginal drying, problems with intimacy, pelvic floor weakening. A lot of times the bladder drops because of pelvic floor weakening, because of poor hormonal balance precipitously at an early age. Dry skin, loss of libido, dry eyes. I put dots. I could go on for 7 or 8 minutes. Just talking about the downsides of what happens when a woman finally goes from the transitional phases to where she starts to drop. So how I would typify this is, for peri, you have something like this happening with your hormones, your estrogen levels over time. There's a downward trend line, but remember, it can peak up for a couple months and then drop, okay? And then once you hit menopause, usually once this scenario, and then you kind of have this, where the levels drop. And at that point, you either are doing okay and you're making it and you're transitioning well, you've transitioned well, or you are battling with what? I can't sleep. I didn't even put on there, gosh, you women are probably looking, what about hot flashes, Joe? You're a man, you have no idea. Hot flashes, night sweats. I can't even function. I go to work and I'm having hot flashes all day. I got night sweats. I can't sleep, Joe. Now when I can't sleep, I can't function the next day. Yeah, amen. I hear you. You can't. So now we're back to the tonifying, back to the balancing, back to the nurse. So hot flashes, night sweats, the emotional, the irritability, the physical symptoms, the eyes, the skin, the bone softening, pelvic floor weakening, vaginal drying. The list goes on. Your life becomes at times just, pretty rough, for lack of a better word. So what do we do here? So I had on that list there HRT, what I feel are the complications or the problems. And this is probably not the setting for this, but just quickly, I feel when we do synthetic or animal-based hormones, we have a host of problems and complications. I don't even want to write them down. It takes too much time. It increases inflammatory markers, interleukin-6, interleukin-10, C-reactive protein. Your blood becomes more clotty, more thickened. It's documented on synthetic and animal-based hormones. You have higher rates of breast complications, fibrocystic breast disease, higher rates of breast cancer. When we use synthetic and animal-based hormones, I had it on that list. I apologize for erasing it. Increasing rates of gallbladder disease. Why? Because your liver has to, or your gallbladder and liver process this excess oral hormones that you are using. And what about the topical ones? Well, if it's topical, it's a little bit better, but there's still technically a synthetic version, but where's your progesterone at? So I just have a problem. I would like at some point just to do a little teaching specifically on this, the contrast between synthetic hormones and natural or biologically identical. In other words, just replacing into a woman's body exactly what her body makes. Does that mean that they don't have the potential for complications? It's not what I said. It is a biologically identical. It mimics your own body. You should be tested. You should be monitored. You should have just enough to kind of maintain your symptoms, improve your overall functionality. That's what we're after. As opposed to these harsh, hardcore synthetic and animal-based, they'll take care of your symptoms. Excuse me. Typically, your symptoms will diminish, but at what cost? All right. Biologically identical is more the way that you go here, and that really is, and if you folks that view these would want me to, I probably would just do that as a separate segment because that's pretty complicated. And I could explain the differences and even give you some pictorials as to why. So let's just get back to what you need. The thing that I missed on the perimenopausal phase, you got to make sure if you drink and you have alcohol, you need to know that's a problem with perimenopause, let alone menopause. All right, so what we want to do here? All right, I think some of the issues are pretty much the same as what you would do with perimenopause. So I'm just looking at this just to make sure I didn't miss much of anything, and I don't feel that I did. So what would we do here at menopause? Hormones of decline. I think at that point in time, you want to do simply a plant-based scenario. You do something like this, like ephemerin. Now, why specifically ephemerin? This is the product that we don't even make, but I like it. It's a very effective product because it provides you with a lot of the key components that I believe are usually beneficial. Gamma-oryzanol, which can help immensely with female hormone imbalances. Black cohosh, standardized to the triterpenes. Dong quai, licorice root with 12% glycyrrhizin, transresveratrol. This is an amazing product because it's not just one. Gamma-oryzanol, black cohosh, dong quai, licorice root, transresveratrol, 4 milligrams per dose, all really helping. So you can do this from a plant standpoint. So you can do something like ephemerin, reduce your alcohol, please, change your diet, more plant-based foods, do some fermented, non-GMO soy. Don't be afraid of that. I know a lot of people are. More beans and legumes. Let's get more fiber. I mean, there are ways to try to, and then basically some of the things we talked about before. Maybe some bioidentical natural progesterone, daily essentials. You've got to have still have some of those tonifying nutrients. And one that I also like is this Essential Woman made by Barleans because it's very high in isoflavones, very high in saponins and lignans and GLA, which a lot of times is very, very helpful, the Essential Woman for gals that are transitioning. You may need more than this. You may be beyond this. And then that's when I would tell you you need a combination, in my mind, of something along the lines of kind of what we would call like maybe a bias, which is a combination of estradiols with some of the other natural hormones, some progesterone. You may need a little bit of testosterone, depending. And then you look at this scenario, along with that CD estrogen. And we're a big believer of estriol here. I believe it's E1. I always forget, but or E3. I can't remember, but that's 3 terminologies for the estrogen. And there's a lot of consternation about estriol. Well, you know, it's not approved here in the United States. Wait a minute. A hormone that your body makes, and it's not approved. All right. Do you know that in the Europe, and I believe in the UK, they use estriol almost exclusively? Estriol. And then those same manufacturers that make it over there don't want you using it here in the States. There's a lot of gimmicking going on, quite frankly. Then even the FDA says, well, you can't make claims about estriol. I'm not making any claims about estriol, but I do have about 30 pages of literature that shows that estriol is documented to be the weakest of the 3 estrogens. Actually, in many scientific articles, it's termed the anti-estrogen estrogen. It helps to facilitate balance. It's protective to women's target organ and tissues, so it's a key component. So with menopause, we still have to do the basics. We still have to nourish the body with adequate nutrients. We still have to provide some tone, right? We still have to provide some balance. So we've got to eat right. We've got to definitely provide some tone with some key nutrients, with the Bs, with vitamin A. That's why you still got to do the daily essentials. Then you might need to really focus on the balance portion, because if you're full-blown, you've hit menopause hard, you can't sleep, you've got hot flashes, you've got night sweats, and you get on to maybe the Femerin, okay? And it maybe helps you or maybe it does not. Sorry, just that. And maybe it does not help you, and if it does not, or you get maybe 50% reduction in symptoms, and maybe you're using some natural progesterone, you're saying, hey, this is great. I can live with this. And I'm changing my diet, and I've cut back on the alcohol. I'm doing more plant-based foods, and I'm doing some protein meal replacements. I've gotten rid of the sugar. All of this, see, all the sugar and the stress and the bad foods will only intensify the level of your symptoms without question. Take that to the bank. More stress, bad diet will intensify a decline in a negative symptom response. So now, all right, now we have to go beyond maybe the more natural facilitative approaches, and now maybe you might need to go into where I replace some bioidentical hormone. I got to replace some things. Why? Because I still have horrible hot flashes. I still have horrible night sweats. My libido is gone. I've got horrible vaginal drying. Intimacy is a huge problem. I have to go to the bathroom all the time. I've got to pee all the time. I mean, everything. I just feel like I'm drying up. My skin's dry. I feel horrible, and I can't sleep, and I can't function the next day. Well, then you might need to go a step beyond this. And then that's where you have to contrast a more biologically identical version with an animal-based or synthetic. So this could be maybe the offshoot for another teaching to really begin to break down and contrast biologically identical. What does that really mean? How does it different than animal-based? Are these not hormones? No, of course they're hormones. They're just exactly what your body makes. But remember, even when you do this, you still got to tonify and nourish and balance. You still have to make sure that you do something like this CD estrogen. Because, well, wait a minute, Joe, they're biologically identical. Well, even a woman that's making her own hormones, I taught you this earlier if you paid attention in the perimenopause, if you don't have if you don't have adequate Bs and adequate tonifying nutrients, I got a lot of bad bacteria in my gut, and I don't eat enough fiber, enough soluble fiber, the list goes on. I recycle these estrogens. I'm not eliminating them. They create some problems. So even a woman making her own, let alone even if she's using biologically identical, should still be using something like this. Calcium D-glucarate, indole carbanols, and diethylmendane. So where do I want to go with this? Animal versus synthetic, no comparison in my mind, clearly. Do you still treat these with respect? Absolutely. Are they without potential problems? No, they are potentially has some problems too. But if you do them correctly, if you do them in low doses, you do them in the right ratio, and you monitor and balance, I think that's a sensible approach. Why? I just want to help to make, and I'll use this word, we want to make your transitional phases, we want to make and help you to transition this portion of your life as well as you can and keep you functional and balanced so that, hey, you can be the wife and the mother that God's called you to be, and the businesswoman or whatever walk of life that you're in. I hope you've enjoyed this. Lot of information. I know it is. I want to encourage you, if we're back here, we're still over here, I want to encourage you with a couple things before we close today. And all right, we're going to go to a couple questions, and I want to talk to you about fear and about personal issues, and just listen to this. But now, this is what the Lord says. He who created you, O Jacob, he who formed you, O Israel, do not fear, for I have redeemed you. God has bought you back. I want you to listen closely. I have summoned you by name. You are mine. God knows your name. And when you pass through the waters, I'll be with you. He doesn't just say you'll pass through them alone. He'll be with you. Now watch this. And when you do pass them, they won't sweep over you. They won't overwhelm you. When you walk through the fire, you will not be burned. The flames will not set you ablaze. For I am the Lord your God, the Holy One of Israel, your Savior. I give Egypt for your ransom, Cush and Seba in your stead, since you are pressured and honored in my sight, and because I love you, I will give people in exchange for you. You might think, well, that's a nice God. What do you mean? He's giving people, that was a sign. Seba and Cush were the southernmost kingdoms, the bottom end of Egypt, which represented the lowness of bondage, of entrapment for the people of Israel. Well, you and I, the Gentiles, or if you're Jewish, of the Jewish faith, you're listening, God has promised redemption, and the Messiah has come, and he's coming back again. The real key here is, do you know him? And this gives us a very specific component that God says, I love you, I know you by name. The book of Genesis, I spoke the worlds into existence, but he says, I formed and I created you. God bless you. Thanks for being with us. Not real sure what the next live streams will be. Hopefully they're of interest to you. We'll try to keep them of interest that you'll enjoy. So blessings to you. I hope you enjoy this. Tell one of your friends or neighbors. Have them tune in. Go to the website, and then we're going to do some questions. I've totally forgot. I keep forgetting the questions. So what do we have, Joe?
Robbie asks if a woman has a clotting disorder with positive, what is that,
anticardiolipin antibodies.
Should I stay away from even the BHRT?
Well, that's you're going to find most medical physicians. The question is, if I have a clotting factor defect, should I stay away? Well, first of all, it seems like almost everybody anymore has those clotting factor defects. I'm not real sure about that. I still think I'd get an MTHFR level. The other thing I would say, literature has shown that when you even do, believe it or not, synthetic estradiol topically, it doesn't upregulate your clotting factor mechanisms. When you do hormones by mouth, when you do them by mouth and they go through the liver, it upregulates your inflammatory proteins, inflammation, upregulates clotting factor mechanisms. That doesn't happen when you do them topically. And there's no real literature. Actually, a lot of the literature shows that natural progesterone, estradiols, estriols actually allow your blood to flow more functionally through your vessel walls. They don't this is key. Boy, this is tough here, but vascular adhesion molecules, VCAMs, vascular adhesion molecules, are actually on the lining of the artery walls that are intensifies and causes more a thickening or a disruption of blood flow. When folks do oral estrogens, animal-based, synthetic, and even bioidentical, that is upregulated. When you do them topically, there's no documentation. So in my opinion, you just have to find an OB-GYN that is open-minded to work with you. I don't really see an issue personally.
He says, I am positive MTHFR for the C1298.
Okay, so MTHFR gives us an indication that there's a more of a clotting factor issue. And I always get the two confused. So I'm not sure if that one is for the blood clotting portion of that. It is. So you have dual risks. So maybe in your case, very specific, very complicated, you start with ephemerin. You even think about some, and I mean this, some natural progesterone. Look at the diet, some non-GMO sources of fermented soy. You might even want to do a non-GMO soy smoothie along with some fermented soy. I would try to manage you more from a facilitative standpoint as well. Now, by the way, though, if you're positive for that MTHFR issue that upregulates your potential for clot and circulatory disorders, you need to be on methyl tetrahydrofolate. We have a form of folic acid that absorbs to a much higher degree methyl tetrahydrofolate. That's what you really need to be on.
Okay, the next question. I have hair growing on my chin and upper lip. Very embarrassing. Can this be stopped? I'm 57, also have bags under my eyes. Can I use anything to reduce the bags? Is this hormones?
I mean, I'm not really sure you can do anything to reduce the bags. We have an eye firming serum that has some natural ingredients that helps with that scenario. But if that's been going on for years, I don't know that you can. If you're still getting some facial hair, we do have some options. I use a specific form of straight saw palmetto because what you're doing with the natural saw palmetto, you're reducing the conversion of testosterone to DHT that encourages this from happening. But I would also want to know what's your weight, what's your level of activity, and I would still recommend you do a saliva hormone test. Because if your testosterone is elevated, I've got to get your testosterone down in proportion, because if testosterone's high, estrogen and then progesterone is even lower, testosterone dominates. What happens is we lose hair where we don't want to lose it because of the conversion of testosterone to DHT, and then I gain it. Wait a minute. I lose it where I want to keep it, and I gain it where I don't want it. Does that make sense? Hopefully that gives you a couple answers. You have any more there for us today, Josiah?
The last one. Joy's son has increased anxiety all the time. He's on Prilosec, but a low dose. He's also taking simvastatin for high cholesterol and was prescribed
okay.
diclofenac for pain in the stomach.
All right, diclofenac or disoclamine? Disoclamine, all that is an antispasmodic that relaxes. All right, how about, why don't you read that back to me, and I'll just so I can.
Prilosec, increased anxiety all the time.
High anxiety on Prilosec. The high anxiety is probably creating digestive disruption. The longer you use the acid-blocking PPIs, you're not going to absorb your B12 as well. We need to get that young man or whoever it is on some coenzyme Bs, some Cabanase, one of those 3 to 4 times a day, all throughout the course of the day, some coenzyme Bs, one with breakfast, one with dinner, and I put him on Mood Essentials. Mood Essentials has methionine, helps you to convert to S-adenomethionine. You then will make some of your brain neurotransmitters better. I would do that for about 6 to 8 weeks, see how the young man does. If he's still having some difficulties, I would then recommend a urinary neurotransmitter test. I think that's about all we have time for. We're way over. God bless you. Remember, you are valued. He has ransomed you, and He has called you by name. God knows your name. God bless you. Thanks for being with us today. I hope you enjoyed the live stream. See you next time.